7:08, we're just talking to Dr. Kevin Most. Let's continue with important medical information with Dr. Eugene Lipov. Earlier on in discussions with the Road Home program folks, we had talked about the best way to communicate the good work that they do for soldiers and the families that experience either the PTSD directly or the effects of it because you love somebody that goes through it. Well, guess what? First responders deal with this every day as well. And they're in your neighborhood, and you might not even know. Doctor, good morning.
Good morning, sir.
Thanks for being on.
How are you today?
I'm fine, thanks. Thanks for being on.
Thank you.
All right, so talk about this, first responders and what we can do and what maybe is being done.
So the first responders basically go through a lot of various trauma. I used to work in the trauma unit at Cook County Hospital. I got to meet a lot of people who were first responders as well as people who had all type of trauma. So essentially when there is trauma or something that's overwhelming, it doesn't matter who you are. You know, if you could be a Green Beret, you could be a policeman, you could be other first responders like EMT, the brain gets activated and can get stuck in that position. And then that's what PTSD, and it actually term prefers PTSI, post-traumatic stress injury. And when people have symptoms of PTSD/PTSI, it ruins their lives, and it's very hard to live that way. So I've had the honor to take care of a number of people from Chicago Police Department, and they were able to get significantly better from that. And that's one of the focuses of my career, actually, is PTSD, PTSI. And since I live in Chicago, I'm very interested in helping our police department and other first responders.
Yeah, well, thank you for focusing your career on that. It's important that not only do we help our military, but also our first responders here. You have a new treatment that it really is, changing lives and making a big difference. Can you explain that? Because if I try to say it, I'll say the words all wrong.
Fair enough. Well, I'll try to keep it less geeky than normal. So basically, there's a system in the body. It's called sympathetic system. Most people know it as fight and flight system. So when trauma occurs, the fight and flight system gets overactivated, and it continues that way. The symptoms of that kind of problem is PTSD, which is the term people use, and difficulty sleeping, overreactive to stress, impulsivity, and so on. So it gets stuck like that, for lack of a better explanation. And people they take medications, and unfortunately medications in psychiatric therapy is about 30-40% effective at max. And it has a lot of downside. So I'm an anesthesiologist, I'm a psychiatrist, and what I found approximately 16 years ago is there is a procedure we do in pain medicine for pain called stellar ganglion block. So it's been modified since now it's called DSR, Dual Sympathetic Reset. Basically, it's an injection in the neck, and what we're actually doing is resetting or rebooting the fight and flight system to pre-trauma state. And the procedure is 5-10 minutes. It's considered safe and effective. And our success rate's been 80-85% success rate.
And you're working with an alderman locally?
Yes, sir. That is, I think we've had success with aldermen, and I was also very much happy to be invited to give a presentation to the city of Chicago.
That's great. And they're saying that this then has a calming effect after you do the injection. But it's interesting, too, because this is sort of new technology, if you will, innovation. Do you think that there's more national research that needs to be done for the treatment?
Well, it is being done. So Fort Bragg did this, which is Green Berets, and Luchheim in Germany, as well as Tripler Hospital, published a paper in Journal of Psychiatry for JAMA, and they published that in 2019. It's a big study being currently done in NYU using functional MRI and all the advanced scanners.
So we're finding out more all the time about it, and it's going to be more. It's like everything else in breaks in medicine. It takes too long once you know you have something that works, but they're moving it more quickly And thanks to the work of folks like Dr. Lipov, it is a very legitimate thing to go and attack something that really can change people's lives for the better. And our friend Mark Doyle has been talking about the ganglion block treatment for veterans for a long time as well. He'll be in a little bit later this hour. But anyway, Dr. Lipov, thank you for that.
Thank you, yeah.
And we
Great
appreciate
work.
you coming on.
Thank you. Take care.
That's Dr. Eugene Lipov.